Hello, I'm Dr. Theodora Kalentzi,
And I'm Dr. Niki Davies.
and we're here at Medical Prime Specialist Menopause Clinic, where we see women with premature menopause, perimenopause, and the menopause.
We see women through a large span of ages. Our youngest patient is in her early 20s and our oldest is in her late 80s.
And we're here today to talk some of the less well-known symptoms from the menopause. And in our clinic, we use a symptom chart which has 36 symptoms, and the list is not exclusive. And we're going to pick 3 of the symptoms that perhaps women do not expect to hear about. And these symptoms are
Palpitations
dry eyes,
and bladder symptoms. Palpitations are a symptom we see many women complain about. A palpitation is the sensation of a racing heart or a chest discomfort or perhaps a fluttering. Women also sometimes feel it in their ears as a fluttering in their ears as well. And women often have been to their GP on many occasions and may have been investigated quite correctly with cardiology investigations, but these have all come back normal. However, this symptom continues to be worrying and troublesome. We know that palpitations are associated with the fluctuations in estrogen levels.
dry eyes. Well, this is a symptom that definitely is the least expected on our list. And of course we know, as with many of the symptoms we have on the chart, that there can be a lot of factors that may trigger, contribute or cause those symptoms. And the same applies with the dry eyes. But did you know that over the age of 50, 60% of women may experience dry eyes? And it is very likely associated to the change of the hormones that we see in the menopause.
Bladder symptoms are also a very common symptom. Women sometimes expect it. They think it's part of the aging process. But of course, nobody needs to put up with these symptoms. We see women who go to the toilet more frequently, or with urgency, they have to rush to get to the toilet, or they wake up during the night several times, and this disturbs their sleep and therefore makes them very fatigued during the day. We know again that the drop in estrogen levels can cause many of these bladder symptoms.
And of course, Dr. Niki, as you said, people associate that with aging process, and we hear that all the time. Of course, I'm getting older, what do you expect? But that shouldn't be the case. And we shouldn't underestimate the effect it may have on our younger patients and how they may be suffering in silence even more.
Absolutely.
Well, we hope you found this discussion helpful, and we've only touched upon 3 of the very many symptoms of the menopause.
We're very happy to talk to you about any of your symptoms here at the Medical Prime Clinic.